Welcome to the Centers for Medicare and Medicaid Services module, the Section J, Health Conditions, Respiratory Status. This module will introduce learners to HIS Section J, Health Conditions, Respiratory Status, which includes items J2030, Screening for Shortness of Breath, and J2040, Treatment for Shortness of Breath. In this module, we're only going to focus on discussing specifications for the individual measures. Although items in this section are also used to calculate the hospice composite measure, we will not cover the details of that measure in this series. For more information on the composite measure, we recommend you review the QM User's Manual, which can be found using the link on the resource slide. This is the fifth of 8 modules in the larger series, HIS Coding Guidance. The series overall is intended for users who are familiar with HIS coding and submission guidelines. For newer users, we recommend starting with the HIS manual and older trainings first. These modules will not cover all items in all sections. Learners may choose to listen to the entire series or may choose to listen to 1 or 2 modules that are of most interest to them, meaning the modules in this series can be watched independently or as a group. Included here on Slide 2 is a list of acronyms that will be used in this presentation, listed in alphabetical order. After completing this module, learners will be able to identify the items that compose Section J, Respiratory Status, as well as their corresponding quality measures and the measure calculations. The items in this section correspond to quality measures NQF 1639, Dyspnea Screening, NQF 1638, Dyspnea Treatment, and NQF 3235, Hospice and Palliative Care Composite Process Measure, Comprehensive Assessment at Admission. Items in Section J, Respiratory Status, capture 2 processes of care that should be delivered around the time of admission to hospice. These 2 care processes capture whether the patient was screened for shortness of breath and if the patient had shortness of breath, whether treatment was initiated. The first care process we will talk about is screening for shortness of breath. J2030 reports whether the patient was screened for shortness of breath, and if so, the date and result of the screening. J2030B captures the first documented screening, and J2030C indicates whether the patient had shortness of breath. Because a structured clinical evaluation for shortness of breath is not well defined, use of a standardized tool for rating severity is not required. It is important to remember that while there is no standardized tool, documentation must still support that evidence of severity was rated using a manner that is clinically appropriate for the patient. Documentation would show that shortness of breath is an active problem for the patient. Select the best response for shortness of breath severity at the time of the visit, during which the screening was performed. NQF 1639 is the percentage of patient stays during which the patient was screened for dyspnea during the initial nursing assessment. The initial nursing assessment in this case is the visit in which the patient was screened. To meet the numerator criteria for dyspnea screening, you must complete the screening for shortness of breath within 2 days of the admission date. Now that we've discussed screening for shortness of breath, let's talk about the treatment for shortness of breath. This item reports if clinical documentation supports that the patient was treated for shortness of breath, and if so, the date and type of treatment. This item is what is called a conditional item, which means you would only complete this item, J2040, if the patient screened positive for shortness of breath as noted in J2030C. As directed in HIS, you would skip J2040 if you answered no to J2030C. Remember, if a patient screens positive for dyspnea but does not want or declines treatment for shortness of breath, this is not held against your organization. NQF 1638 is the percentage of patient stays during which the patient screened positive for dyspnea and received treatment within 1 day of the screening. Like the item itself, NQF 1638 measure is also conditional. It only applies to patients who screened positive for dyspnea. If the patient screened negative for dyspnea, they are excluded from the denominator and are not part of the dyspnea treatment measure calculation at all. Thus, patients who screen negative have no impact on your treatment QM performance. For those patients that do screen positive, to also meet the numerator criteria for dyspnea treatment, treatment for shortness of breath must be received within 1 day of screening positive for dyspnea. While the series overall is intended for users who are familiar with HIS coding and submission guidelines, information regarding the Hospice Quality Reporting Program can be found by clicking the hyperlink on this resource slide. This resource slide also contains hyperlinks to specifics on the HIS hospice quality measures, the QM User's Manual, and the HIS Manual V2 with the change table. The Hospice Quality Help Desk is available to assist with general questions about the Hospice Quality Reporting Program. This concludes the module Section J, Respiratory Status. This module covered the items in Section J, Respiratory Status, including the shortness of breath screening and treatment items, as well as their associated quality measures. This module is the 5th of 8 modules in the series, Hospice Item Set Coding. The other modules in this training series are listed here, and we encourage you to view these training modules as well, to understand more about HIS coding and learn how it may help you in your hospice. Thank you for viewing this presentation. The information presented was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.